Was the recording of last time okay? Hello?
Yes, quite, for me it was okay.
Okay. Or should I just, today maybe I can send you the slides, because I'm doing this course, online teaching course, and I've learned few tips of not being too monotonous. I thought, when I saw the recording, I thought it was quite monotonous. So I've tried to make it a little interesting for today's session. This is a real difficult thing that I can't see all of you, and I have to talk to my computer. So maybe you also will get tired and I will also get tired. So I've tried to put in few other things. Let's see whether it works. So at the end of the class, you'll tell me whether it has been useful or not. Okay, so let's go for hypersensitivity. And you are all MMed students. You have done hypersensitivity in your undergraduate level. But I'll touch a few basics as well. The way this class is going to go is that we'll do the basics, and then I have few papers related to orthopedics and surgeons, which I'll share on the email. I'll send it on the MOI registrar's group so that you can have some reading as well. Is that okay?
Yes, that's okay.
Okay, fine. I needed that response so that I know that you guys are there. Oh, are we 13?
Yes.
Okay, so let's start. Let's make it interactive, even if I can't see you. Maybe I can see you if I did something else. No, if I'm sharing my screen, I can't see you. Okay. Fine. So anybody has any memory regarding hypersensitivity from undergraduate? What are the various types of hypersensitivity reactions? Hello.
We can hear you, Prof.
Yep. So I asked a question, so no one is answering.
Okay, so let me start us off.
Otherwise, you'll fall asleep. Yeah. Sorry, somebody was talking.
You said there are 4 types.
Okay.
It's type 1, type 2, type 3, and type 4.
Okay. That's easy.
Yeah.
That's good.
Yeah. And then type 1, we know it's usually caused by stimulation of IgE, IgE immunoglobulin,
Yes.
which occur when which will basically occur as a result of allergic reaction. So
Yes.
IgG is produced, and then it causes feature like weaves and urticaria on the body.
Okay.
Yeah. Then type 2 is caused when there is a antigen-antibody interaction.
Okay.
So in this case, a good example is in blood transfusion.
Yes.
Whereby if you get a person with blood group A, get it transfused with blood group B, then because of the antibody-antigen interaction, then it causes hypersensitivity, which will present with some clinical features that we can see later.
Okay.
And type 3 and type 4, I'm not so sure, but I know type 4 is a bit delay or comes after some days. Maybe it can take 72 hours, even to up to a week.
Okay.
Yeah.
Fine. Anybody seen any of these reactions? Any? Type 1, type 2, type 3, type 4, any of the reactions? In your experience, you haven't seen any? Anybody? This is a very healthy class. They have, anybody's got any allergies?
Maybe you can ask, maybe what about the bee stings? We have seen a lot of bee sting in hospitals.
Yeah, so that is called which are hypersensitivity reaction is caused by? Fine. Okay. But it is an allergic reaction, yeah, to bee sting. No one else has got eczema, diarrhea, any food allergy.
Eczema. Hello, Prof.
Yes.
And I personally have eczema.
I can't hear you.
I'm saying I have eczema.
You have eczema. Okay, so that is also, it could be due to some allergen. Okay, not all eczemas are hypersensitivity reactions, but some of the eczema are allergic dermatitis.
What about the reactions to drugs?
Fine. Like aspirin or penicillin or something? Yes, they are hypersensitivity reactions as well. Fine, so we know a little bit about hypersensitivity reactions, and we are still sticking to the Gell and Coombs classification that you did in undergraduate. However, in the middle, I think a few years ago, 8-9 years ago, they had said that there is a type 5 hypersensitivity, but it has been included among the type 2. So there are only 4 types of hypersensitivity reactions. Type 1, as you rightly said, mediated by IgE. Can you see my arrow when I'm doing this?
Yes, we can.
Okay, so mediated by IgE, and what cell do you think this is? We are in immunology, so everything will be antigen, antibody.
Look like it's
mast
not.
cells.
Yeah, so mast cell is very important. You can see the granules. Here it is getting degranulated because of the cross-linking of the antibody, which we have said it is IgE, with an allergen, and this could be a pollen. And once this happens, it degranulates. Sorry. So that is type 1, IgE mediated, and it is the classic allergy. And the way to remember hypersensitivity is very easy. It's like A, B, C, and D. A stands for allergen or anaphylaxis or atopy. So type 1 is A, and type 2 is, Dr. Ari mentioned that it is antibody mediated. So B stands for antibody. So A, B, it is antibody mediated, and a lot of hemolytic anemias are caused by type 2 reactions. Type 3 is type 3 is immune complex mediated. So it has not only the antibody, but the antigen. So it's the antigen antibody complex that is formed that causes the pathology. So these immune complexes go and deposit somewhere, and the host immune system thinks it's something to get rid of, and therefore a pathology is caused. So A is for allergen, B is for antibody, C is for complex, immune complexes, and D is delayed type hypersensitivity, which is type 4, and it is mostly T cell mediated. So there is no antibody over here. It is a cell mediated immunity. So, but it is delayed because it's not immediate like the type 1. Type 1 occurs immediately in the first 5 to half an hour, but type 4, it occurs after a few days. So this is just a summary of what you know already. And there are various diseases associated with the types. So these first 2-3 slides I always keep important, because after 5 minutes, if you fall asleep, at least you have seen these few slides and you remember it. I hope you are not asleep. Hello.
No, we are not, Doc. We are here.
Oh, yeah, okay.
We are taking coffee.
Okay, yeah, I can drink water as well. Okay, so type 1 anaphylaxis, asthma is also included, and food allergy as well. Type 2, anemias, hemolytic anemias, Graves' disease and myasthenia gravis. These were put in type 4 a few years ago, but they've come back in type 2, and we'll see why. And because we said it's second and it's B, it's antibody mediated. Type 3, various autoimmune disorders, especially SLE, glomerulonephritis are seen in this disease. And it is antibody antigen complexes that are responsible for causing the pathology and inflammation. Type 4, you have contact dermatitis. Anybody allergic to anything? I have a patient who, whenever they wear a particular type of fabric, they just break out in a rash. So it could be due to the material, it could be due to soap, or it could be due to poison ivy, which is a classic example. It's a weed when people go for trekking. The Manto test, we all have been vaccinated with BCG, and you have an induration on your hand, and it's still there till today. So that is because of the delayed type hypersensitivity reactions. So let's go to type 1 hypersensitivity a little deeper. And I have a small video just so that we understand the mechanism. And it is a little bit interactive so that there are a few questions that you need to answer. So this is a new thing I've learned. Maybe you guys know it, but I learned it today.
Our topic today is type 1 hypersensitivity. Two common examples of type 1 hypersensitivity reactions include food allergy and allergic rhinosinusitis. Let's begin by talking about food allergies. The exact prevalence rate for food allergies is unknown, but in the United States, food allergies are believed to affect 4% of children and 1% of adults. Most any food can produce an allergic response, but did you know that 97% of food-related allergies are due to just 8 foods? Of the foods shown, can you guess which 8 they are?
Can you guess which 8 they are? Hello? Hello?
Yes, Doc.
Yeah. Can you please tell me from here, which do you think are the most potent allergen?
The protein?
Most potent, most which of this could be a allergen? Any food can cause allergy, but there are some common ones. The most potent ones are?
Lactose.
Sorry?
Lactose?
Okay, so lactose is, you are talking of lactose intolerance. So that is milk, but it is not the milk that is causing the reaction. It is the sugar lactose in the milk. And that we classify in intolerance. So when you are intolerant to something, it's not a food allergy.
Oh, okay.
Okay, because you are missing an enzyme to break the lactose into, you are missing lactase, and therefore you become intolerant to lactose. So that is not an allergy.
What eggs?
Yes, eggs is a good example. It usually occurs in children, in infants, but usually you grow out of that allergy. So there are 8 foods over here. Which other thing do you think can cause an allergy?
Nuts?
Nuts.
Yes, peanuts. Luckily, I don't know about all the African countries, but especially in Kenya, I have not seen any patient with a peanut allergy, which is very good because it is a very dangerous allergen. And in the Western countries, people die of it. Children die of peanut allergy. And a little exposure, so even if they are flying in the aeroplane and they give you these small sachets of nuts, if somebody in the 5-6 rows ahead of that child opens the packet, that allergen can be traveling in air. It's called LR allergen, and that can cause this child to, if he's sensitive or if he's allergic to peanuts, he can go into anaphylaxis. So it is quite dangerous. Why do you think we don't have peanut allergy? We don't see a lot of peanut allergy here. Anybody?
Maybe our bodies is already sensitized.
Yeah, because our mothers, and we have peanut everywhere. Like when I'm hungry, I just ask my messenger to go and get the jugu karanga from downstairs. So we see peanut everywhere. Our mothers, whenever they are pregnant, are also eating peanuts. It's a major part of our diet, isn't it? We snack on it. Am I correct?
Yes.
Yes, Doc.
Yes, okay. So we've seen peanut earlier in our life, and therefore we are not very allergic to it. Any other allergen?
Soy?
Sorry?
Soybean?
Yes, soybean can be an allergen as well. Somebody said nuts, so I'll consider these. Tree nuts are like almonds, cashew nut, pecans, walnuts. These are also potent allergens. So eggs, nuts, peanut, soya. You can be allergic to milk as well, not the lactose in the milk, but the protein in the milk. Okay, so children can be, once you stop breastfeeding them or you start mix feeding with cow's milk, they can break out in a rash. You might see eczema on these children who are allergic to milk, but they outgrow it.
Honey?
And sorry?
Do you have honey?
I don't have honey, but do you know of anybody who could be allergic to honey?
Yes.
Okay, so he or she might be allergic to bees as well, or the pollen in the honey might be giving him a reaction. Okay, so but the common ones are the ones I'm talking of. So seafood like prawns, they call it jinga if you know, prawns and shellfish. People in Mombasa and living in the coast, usually I see people from the coast having this allergy because they're exposed to this kind of fish. I've not seen anybody reacting to tilapia or Nile perch here in Eldoret.
My brother reacts to tilapia. I mean to Nile perch.
Oh, Quelly,
Yeah.
that's good to know. Oh, wow. What happens to him when he eats?
I usually get some pimples.
Okay. On the body, the whole body, urticaria?
No, urticaria, no.
Okay.
Mm.
Then these pimples are what? They are not liquid filled. Or they are like what you get on your face when you are... Sorry?
They're liquid filled, but then they disappear after some few days.
Okay. And he can be taking antihistamine when he knows that he's going to eat fish.
Yeah.
So that he can stop the nip the reaction in the bud.
Yes.
Okay. So you could be allergic to wheat as well. Okay. So that's another allergen as well.
If you answered tree-grown nuts, milk, peanuts, soy, peas, eggs, seafood or shellfish, and wheat, then you are correct. Out of the 8 most common allergy-causing food, 3 foods are most likely to cause anaphylaxis, which is a whole-body, life-threatening allergic response. These include tree-grown nuts, seafood or shellfish, and peanuts. It is estimated that in the US, 200 people die each year due to severe allergic responses to food. It is also estimated that 1% of Americans are specifically allergic to peanuts, and peanut allergy is the leading cause of death due to anaphylaxis. Interestingly, most individuals who experience milk, egg, wheat, and soy allergies as children can develop tolerance to these foods later in life. But those with allergies to peanuts, tree-grown nuts, and seafood or shellfish often remain allergic to these foods throughout life. As mentioned, allergic rhinosinusitis is also a type 1 hypersensitivity reaction. Common respiratory allergens include pollen, fungal spores, feces of house dust mites, and animal dander. Exposure to these may lead to allergic sinusitis in susceptible individuals. Animal dander refers to the microscopic particles of skin or fur shed from animals, including cats and dogs. People who are allergic to mice or gerbils are not actually allergic to the dander, but to some of the urine components in the animal cages. In certain individuals, inhaled allergens may cause allergic rhinosinusitis. Now for the mechanism of a type 1 hypersensitivity reaction. The process begins as an allergen, such as pollen, is inhaled into the respiratory system and is processed by an antigen-presenting cell, or APC. The APC presents a portion of the pollen to a naive T helper cell. At this point, the APC also releases the cytokine IL-4 onto the T helper cell, which causes the naive T helper cell to differentiate into a T helper 2 or Th2 cell. A B cell also presents a portion of the pollen to a T helper 2 cell. The T helper 2 cell then releases IL-4, which activates a class switch of the B cell to cause it to become a plasma cell that produces IgE antibodies. The released IgE antibodies bind to Fc receptors located on mast cells and basophils. On subsequent exposure to the allergen binds to 2 separate IgE antibodies on the mast cells or basophils. This is known as cross-linking and causes degranulation that releases inflammatory mediators, including histamine. This brings about a primary hypersensitivity reaction, or early response, that includes vasodilation, bronchoconstriction, and endothelial retraction, which brings about edema. This early response begins within 5 to 30 minutes and subsides after about an hour. The T helper 2 cell also releases IL-13, which causes epithelial cells to produce mucus. A secondary reaction begins within 2 to 7 hours and may last for days. This late reaction involves the recruitment and activation of leukocytes, like eosinophils, as the T helper 2 cells release IL-3 and IL-5, and as mast cells release eosinophil chemotactic factor. Eosinophils can be destructive to tissues and cause cell damage. Lipid mediators produced from arachidonic acid are also a significant part of the late response and include prostaglandins and leukotrienes that have similar effects as histamine. Leukotrienes are particularly potent bronchoconstrictors. Now for some questions to assess your understanding. Pause the video now and think of your answers. If you answered the following, you are correct.
Okay. So which class of antibodies play an important role in type 1?
IgE.
Very good. Which type of T cell plays an important role in type 1?
Correct.
H2.
Okay. Which cytokine causes B cells to produce IgE?
Leukotriene.
Cytokine, yeah. But for, in the beginning of the reaction,
IL-4.
IL-4, okay. Which best describes cross-linking? One allergen binding to two separate antibodies or two allergens binding to one antibody? Come on, the answer is also here.
Histamine?
So on the surface of the cell, you need two IgEs, and those will bind to one antigen, and that is called cross-linking. So you need one allergen but two antibodies to get the cross-linking, to activate the mast cells. Is that clear? Or I go back to the diagram?
Yeah.
It's clear, yeah? Okay. Which cells are primarily involved in the late or the secondary response? So basophils and mast cells are in the beginning, T helper cells are in the middle, and then eosinophils are the last to come, and they cause the damage. So if you get a patient who's allergic to something and comes to the hospital, and you give them antihistamines and they feel better, don't discharge them. Keep them under your observation for another at least 5 to 7 hours, because they can get the late phase reactions, which are even more potent. Yeah?
Yes.
No.
Thanks for watching.
Okay. How do I get out? Exit full screen. Go this X. This can go down, and we continue. Okay, so this is the first time I'm doing this, so I'm highly excited that it worked. Fine, so type 1, as you know, and some of my slides will be repetitions because I didn't know that I'll be putting these videos on. So I'll just skim through them because we've already done the mechanism. But type 1, as we have seen, it can cause problems in any of the systems. So in the cutaneous system, it causes urticaria, which is hives. It can also cause angioedema, respiratory, wheezing and sneezing. GI, people complain of feeling cramps and having diarrhea, vomiting. It can also cause trachycardia in your cardiovascular system, CNS. You could get seizures as well. And sometimes people complain of atypical symptoms, like they say that they get a metallic taste in the mouth, or they feel a fear of impending doom as well. So type 1 reactions are can occur anywhere in the body. The symptoms are itchiness, wheeziness. You can have blisters, like we just saw somebody getting allergic to Nile perch. You can have an upset stomach, vomiting, edema. And type 1, to recognize type 1 reaction, it's very important. And now you will see a surge in allergies. So our generation didn't see a lot, but you will see a lot of children or patients with those reactions. And probably you can answer that question why later on, or you can ask me. So it's important that we know about them. Anaphylaxis, as you know, it means phylaxis means to prevent or protect, but something that is reverse is anaphylaxis. Typical symptoms are rhinitis, conjunctivitis, and hay fever. Anybody suffering from hay fever in this class? Yes, no? Anybody suffering from hay fever? You can say no if you are not, so that I know that you are all here.
No.
No, we haven't.
Okay, I suffer from hay fever, and that's why I sneezed also when when we started the class. I'm allergic to grass pollen. So, and my library, behind my library is a lot of grass, and they are cutting it today. So that's why I'll have sneezing bouts. So I'm allergic to grass pollen, and that gives me hay fever. I feel itchy, I wheeze, and I have to take antihistamines. Okay, so what is the difference between an antigen and an allergen? Anybody can give me that? Do you think the pollen that I'm allergic to, grass pollen, is an antigen?
No, I think it's an allergen.
Yes, because an antigen is something, for example, let's say Staph aureus. If you get an infection with Staph aureus and if I get an infection with Staph aureus, we'll have similar symptoms. Yeah, but an allergen is something that I am allergic to the grass pollen, but you are not. So not everybody is reacts to an allergen. Okay, so not everybody reacts to grass pollen, for example, and the person who gets reacted with grass pollen, for them, grass pollen is an allergen. Okay, and allergy is on a rise, and there's a hypothesis, the hygiene hypothesis. Anybody knows about the hygiene hypothesis? And because of, yeah, I thought somebody is going to answer because I heard a chime.
I've not heard about it.
Okay, you have not heard about the hygiene hypothesis. Okay, so in the Western world, what happens is the parents keep the babies very clean, and they are constantly wiping their hands and mouth with these antibacterial wipes, and they think they are doing their children a good service by keeping them in a near enough sterile environment, because they are forever wiping surfaces so that the baby doesn't get infected. So because of that, they feel that the babies over there don't see a lot of allergens, or they don't see a lot of antigens, and hence the IgE is free. So once IgE is free, it loads on the mast cells, and therefore any small thing they see, they feel the mast cells degranulate and cause an allergic reaction. So we don't see a lot of allergies here because we let our children play in the mud. We don't constantly wipe their faces and hands. And most of us living in sub-Saharan Africa already have been infected with worms, and we get all sorts of infections. So our immune system is constantly being challenged, and it is working, and it is working in the right way by getting rid of the bacteria or the fungi or the worms that is causing the infection. So it has a lot of work. So it doesn't have time to react to things like pollen and various other foods. So that is the hygiene hypothesis. And then sometimes it could be something that you could have because of genetics, and especially my family is an atopic family. So my maternal uncle has eczema, my mother has eczema, my father has asthma. So asthma, hay fever, and eczema go hand in hand as atopic. So children with parents who are atopic can also get. So in spite of not having the hygiene hypothesis, in spite of being born in Africa, I still have an allergy because I'm predisposed. So that could be the reason why we have the allergies that we see. However, I'm saying now that there'll be a rise in allergies is because we are now becoming a little affluent, and we are now getting the Western ideas. So we keep our babies very clean. We don't let them play in the mud. We keep our houses very clean, and they're washed with jik and everything. It's not a bad thing. Please, in this Corona age, keep on doing it. But I'm just saying that we will see an increase in allergies now. So these are the 8 common food that can give us allergies. So fish is, I'm happy to see that there is a Nile perch allergy. So at least this is working even in our setup, except for the peanuts. So you can get allergic to kiwi. You see a lot of seeds in the fruit. Those fruits can be, then can cause you allergy. But then we even have these passion fruit or these matundas that we eat, which is full of seeds. But I've not seen anybody with that allergy yet. I've seen people with allergies to strawberry. And the latest kid on the block of allergy is potatoes. No one is saying, oh my God, or something like that. Here we eat a lot of fries. Are you asleep, guys?
No.
No, we are listening.
We are following. We are wondering what potato.
Yeah. You are wondering, this innocent looking potato, how can it cause an allergy? So I did a master's at Imperial College. I just finished last year. And my thesis was on pollen food syndrome, if it has any relationship with IBS. And pollen food syndrome is, so in England, a lot of people suffer from hay fever. So in this time, which is between March to July, there is a lot of pollen in the air because it becomes warm. And people inhale that pollen and they get allergic reactions to it. They get hay fever, which is itchy, wheezy. And in that season, if they ate a fruit like strawberries or melon or kiwi, then they would get something like oral pollen syndrome, which is they get eczema all around the mouth, or they get tingling sensation on their tongue, or they feel itchy, or they feel scratchy in their mouth after taking a food that they normally eat and doesn't cause a reaction. But it is because the body sees, because it is so used to reacting with pollen, and there's so much pollen in the atmosphere, that any fruit antigen, any protein in any fruit that resembles the pollen antigen, it starts reacting. So my research was, I was interested in irritable bowel syndrome because my family, my mother and my sister's daughter has IBS, and we lost her when she was 17 years old. So I wanted to do some research on IBS and see what could be another cause. Could that be an allergic reaction? And we saw a lot of patients who had pollen food syndrome, who had hay fever, and who had IBS. And we saw that patients who had pollen food syndrome or who had hay fever reacted to a lot of foods. And the surprising thing was potato was coming up. And it was something that we didn't believe it. But then when we did some literature search, there is a study in Zimbabwe which quoted that their patients were reacting to potatoes as well. So the skin is a part that could be more allergic. So chips are okay, but we try to be very healthy, and we have chips with skin on, and that could be a potent allergen. So that was my research anyway. So I'll skip these slides because we've already seen the video of these slides. So you could be allergic to not only nuts and the foods that we have seen, but we mentioned like the bee venom. I've seen people allergic to cockroaches, and most of my patients are allergic to house dust mites in Eldoret. Some I have who are allergic to moles as well. I have not seen a lot of children or adults allergic to their cats and dogs or any of the farm animals. Not seen a lot of plant pollens people allergic to, but this is in the US or in the Western countries, even in the UK and Europe, a lot of them are allergic to pollen. Even in Spain, they are allergic to olive pollen because they have olive plantations. Another food that could be allergic is green apples in the pollen season. So because that resembles, the antigen resembles the antigen in the apple as well. And also, as we see a lot of our patients, they might be reacting to the drugs. And all these are type 1 hypersensitivity reaction. And remember, type 1 is IgE, and the mast cells play a very big role in the beginning, and then you could get a secondary reaction where leukotrienes and eosinophils causes the tissue damage. So, and it's a Th2. Yeah.
How about
Tell
wheat?
me.
I've seen people saying they're allergic to wheat.
To wheat?
Yes.
Manu? Yeah?
Yes, Prof.
Yeah. So in our first slides, we saw that wheat could cause an allergic reaction as well. So the germ in the wheat has a protein in it as well. So that could be something that a person is allergic to. So you and me are probably not reacting to wheat, but there might be somebody who reacts to bread or chapo or mandazi, and they feel, what is it in mandazi that causes them a problem? But they could be reacting to wheat. Do you know of anybody who's reacting to wheat?
Yes, in Nairobi.
Okay. See, now that is the city where they are all doing the hygiene, and they don't see a lot of dust, and they keep everything clean and neat.
Yes.
Us in Mushtuni, we are more healthier because we inhale all sorts of things, and we are in the midst of a lot of antigens. So our immune system is kept busy. Okay, so yes, you could react to wheat. And then there is something, we had a patient when I was doing my study in the UK who was okay with wheat. So normally he could eat bread and everything. But one day he ate a pizza and went for exercising. So, and after exercises, he just swelled up. He had almost an anaphylaxis reaction. He was rushed to the hospital. And we then did all the tests, and we saw that it is exercise-induced allergic reaction to wheat. So the pizza obviously is made out of wheat, the flour, the base of the pizza. So if you, so rightly so, they say that when you go for exercises, go on an empty stomach or at least 2 hours after you have eaten. So there is something called exercise-induced anaphylaxis or hypersensitivity reactions. Okay. We also have patients, especially here, I've seen few, one of them is our student even at Moi. She reacts to cold, and her whole lips and everything swell up. Now, right now it's her season to be swelling up. So you can react to cold. I have a theater nurse here in Eldoret again, and he, because the air conditionings are on, he reacts in the theater. So if he has a shower with cold water, he has urticaria. So you could be reacting to heat and cold as well. So not only wheat, but other things as well.
Question.
Sorry?
I have a
Yes.
question. Now, those people who react to cold water,
Yeah.
is there a medication they can take prior to using cold water, or they just avoid cold water completely?
So taking antihistamine would be good, because if it is a type 1 hypersensitivity, then we are blocking the histamine that is released when the mast cells degranulate. So that is a good thing to take an antihistamine before they get exposed to cold. But it's a good idea to have a warm water bath or to expose them to warm water. Yeah. Okay.
Okay, thank you.
So the house dust mites are very tiny creatures. Obviously, you can't see it with your naked eye, but it is not the mite itself that gives us the problem, but it is the fecal pellets of the house dust mite that gives the problem. So here is your epithelium, and there is these are the tight junctions between the cells. And the mites in the fecal matter have an enzyme, DERP1, and DERP1 can cleave the tight junctions and can enter. And once they enter in your dendritic cells in the skin, will take the antigen up and process it and show on the surface. And then the mast cells will see it as foreign and starts degranulating with the help of T and B cells. So the pathology is caused by the enzyme that is excreted by the house dust mites. So this is a very common problem here. We discussed about atopy. You could have the genetic predisposition to type 1 because you might have a polymorphic gene to IL-4. Remember in the diagram, we said the first thing that is secreted is IL-4. I have another diagram now, which we'll go into. And so the first time you're exposed to an allergen, you don't see a reaction, but a repeated exposure, because by then the mast cells would have been primed, they would have the antibody sitting on their surface, and then they'll cause the degranulation. I have a better one. This is the one. So these are your epithelial cell. You have inhaled pollen or an antigen. If you have inhaled an antigen, your dendritic cell will get a T cell that is naive, and it can recognize this antigen, and it can either proceed to becoming a Th1 cell or becoming a Th2 cell, a T helper 1 cell. Now it can proceed to become a T helper cell 1 in the presence of a cytokine called IL-12. So if there is a lot of IL-12 in the environment, it will proceed, which is normal for you and me. We have, whenever we see an antigen, this normal happens. Th1 cells gets activated, and then the T cell asks the B cell for help, and we produce IgM. So even if we are in, even if it is a flu virus or the sore throat I'm having or COVID or whatever, then this is the reaction that comes, and you measure the IgG or IgM in the person. But what happens in an atopic individual who are allergic to pollen or food, as they have a lot of IL-4 because there is a polymorphic gene that they have, and there is a lot of IL-4 in their system, and that will drive the reaction to the B cell producing IgE. So obviously there is co-stimulation between the T and the B cell, and then they'll produce IgE. But it is the presence of IL-4 that is important in these allergic reactions. Okay, so hence it is important not only in type 1, which is an IgE, mast cells and basophils are important, But the most important driving cytokine is IL-4, IL-5, and IL-13. IL-4 and IL-13 will drive Th2 to B cells, while IL-5 will recruit the eosinophils, which are potent and which causes the damage. So in the first phase, when the antigen is there, these cells will be the ones that would come for the party, the mast cells, macrophages, neutrophils, basophils, and they release histamines. So if you give patients antihistamines, this reaction is blocked. However, in spite of blocking this reaction, the reaction, if there is a lot of antigen or if the patient is prone to a lot of allergic reactions, the reaction will proceed and you'll get the eosinophils coming in and producing all the other factors that can cause the damage. So other leukotrienes and eosinophils causes the damage in the late phase. Hence, you need to keep the patient under observation for a few hours so that you see that the late phase reaction does not happen. And if it happens, you can treat it before sending our patients back. So sensitization is the first stage where you get exposed to an allergen, but you don't show any reaction. And then you see the reactions. So this is very biological. I'll leave it. This is again showing an immediate reaction and then a late phase after 8 to 10 hours. So you see a localized reaction in the first immediately, being bitten by a bee or eating something and you're broken out in a rash, but then it becomes more, it's no longer focused, it's become generalized. It's the presence of leukotrienes and all the cytokines that makes it. Eosinophils, it makes all these other cytokines and other lipid mediators that causes the pathology. So if the target organ is the digestive tract, if you have eaten something, then you'll start feel like vomiting, cramping, diarrhea. I've seen children who are allergic to eggs. As soon as you put an egg in their mouth, a little piece of boiled egg, they will start throwing up. If it is the skin, then it will become inflamed and you'll start getting itchy. If it is the airways, so if you something you have inhaled, then you will sneeze or wheeze, as in case of asthma. So asthma could be allergic asthma as well. So asthma is very common in this place. And we are planning to do a study whether it is allergic asthma or asthma due to other factors, especially because when our mothers cook on outdoor fires or on Gico and wood, that could cause asthma, but that is not an allergic reaction. So how many of you have heard what an EpiPen is? This is an EpiPen.
Is the one for adrenaline injection?
It is there for, sorry?
There's one I've ever seen, I think. Is it the one that you can self-inject? It has adrenaline.
Yes. So it has adrenaline and you self-inject it. Even if you're wearing clothes, you don't have to remove clothes. As soon as you start feeling the reaction, you just jab yourself. And once you jab, there's a needle over here that just releases the epinephrine in the body. So people with a lot of allergies or with bee venom allergy, any food allergy, children, they are supposed to carry these pens so that once they get exposed, before they can be taken to the hospital, they are given epinephrine. A lot of schools in the UK and the US keep epinephrines for children who are allergic. A lot of children in the Western world are allergic to lots of things. So they bring food from home, and if they share food, obviously children share food, and they don't know what the other mother has done. We had a Chinese family, and Chinese eat a lot of peanut. butter, and they have peanut sauces and everything. So this child who was allergic to peanuts was sitting next to this child who was having peanut sauce in the food, in rice or something, and that child had to be rushed. So we immunologists are working very hard, and we now have immunotherapy for a few of the antigens, and mostly for pollen, and for few of the food allergens as well. And that could be what we are doing is desensitizing by giving repeated doses of the allergen, of what you are allergic to in doses. If it is egg, or if it is grass pollen or tree pollen, you can inject them, or now they can even have these sublingual tablets that we give to patients. They put it under their tongue every day, and the dose increases. So, and it has been shown to be efficient. So the idea is to prime the immune system, so giving a low dose of the allergen every day, meaning that we are now inducing them to make IgG and not IgE, because IgE will cause mast cell degranulation, while IgG will not. So we are shifting the formation of IgE to IgG. So that is the idea. Another thing that I do here in Eldoret, so in this region, I'm the only allergist. We call ourselves allergogist. And we have one in Nairobi in Upper Hill, Professor Bowry, and now her daughter has done the same course that I have done at Imperial College. We did a 2-year master's course. Mine went till 4 years because I took a break in the middle. So we now have the expertise in the country. There are few allergists coming up in Nairobi, but in this part of the country, I do the skin prick test, where we prick the patient with known allergens, and if they are positive, then there's a formation of wheal like this. Okay, so this patient is allergic to a lot of animals and pollens. We also have ImmunoCap, which is a ELISA-based test, but this is quite expensive to do, because skin prick test you can do at least 20 or 30 at one time and see. And once you see that you are allergic to something, you can cross-check with ImmunoCap. But we cannot do ImmunoCap for each and every allergen. It becomes too expensive for our patients here. Then there is something called a patch test, which is something that I do here as well. And those are for type 4 hypersensitivity reactions, that is delayed type 4. Patch test. So the previous was a skin prick test, where we prick the skin. And we also can do the skin patch test. So we put the allergens on patches. Okay, and see the reaction after 2 or 3 days. Till
For the
70.
skin test, do you apply some chemicals?
So on the skin prick test, yes, these are not chemicals, but these are allergens. But for the patch test, it will be chemicals.
Okay, thank you.
Like nickel sulfate, the para PPD, which is in the hair dyes and things like that. Okay, but this is for delayed type hypersensitivity. Okay, this is just 2 things that came one after another, but this slide should have gone at the last. Okay, so for this group, it is important to recognize, if you are putting an implant, to recognize the reaction. So you might not see a reaction immediately, but you can probably see it after a few days, and you should be able to recognize that this is a delayed type reaction. But for type 1, you can have eczema, urticaria, and allergic to, for the dentist, there might be somebody who's allergic to the the material that they have used. This is my paper that has been published just in December last year on pollen food syndrome and irritable bowel syndrome. If you are interested, you can have a read. It is free online. Fine, so that was type 1, and you need to know the mechanisms and the reactions that are caused. It's very important for you to recognize that. And I hear that some people even laugh. I get a lot of different types of patients. So I get patients who say, oh, I'm allergic to everything that I eat. Anything I eat, I get allergic reactions. So there are extremes. And there are others who say, I eat such and such a thing, but of course not. It can't cause a problem. Another thing I've seen in our place is, the Duma. Hello? Are we there?
Yes, we are.
Okay, Duma. What is it called? It's like it's a tuber, but it is purple in color.
Arrowroot.
Arrowroot, yeah. So some people are allergic to that as well, but that is not a type 1 hypersensitivity reaction. Arrowroot has some crystals in it that can cause itching or scratching in the mouth. So if you get a patient who has had arrowroot and is feeling itchy, ask them to drink warm water. You can give them antihistamines as well. But it is mostly the crystals in the arrowroot that a lot of people cannot take. Fine, let's move on to type 2. Type 2 is what? Type 2 is caused by?
Antibody.
Antibody dependent.
Yes, antibody dependent.
There's a pervasive myth out there that exercise is a good strategy for weight loss or for health. Having a hypersensitivity means that the immune system is reacting to something in a way that damages the body rather than protecting it. There are 4 different types of hypersensitivities. And the second type, or type 2 hypersensitivity, is sometimes called cytotoxic hypersensitivity because a lot of disorders caused by this hypersensitivity involve antibody-mediated destruction of healthy cells. These disorders tend to be tissue-specific, meaning that the antibodies are generally specific to one type of tissue or organ. There are other antibody-mediated hypersensitivities that are systemic, but these are generally type 3 hypersensitivities. So our immune system is set up to fight anything that's considered non-self, right? Anything that's not self, or you. This works in large part because of a process called central tolerance, which is when developing immune cells that are self-reactive get destroyed or inactivated, whereas immune cells that aren't are allowed to survive. And this happens while they're still in their primary lymphoid organs, which is the thymus for T cells and bone marrow for B cells. This process, though, isn't perfect, and some self-reactive B and T cells will escape. These escaped self-reactive cells can then attack healthy tissue, which results in an autoimmune disease. In type 2 hypersensitivity, these escaped self-reactive B cells become activated and produce IgM, or with the help of CD4 positive T helper cells, IgG antibodies that attach to antigens on host cells. And there are 2 types of antigens involved with type 2 hypersensitivity. Intrinsic, meaning an antigen that the host cell normally makes, or extrinsic, which is an antigen from an infection or even some medications like penicillin that gets attached to the host cell. All right, so let's say a drug like penicillin binds to a red blood cell. Well, it becomes an extrinsic antigen. An IgG, or more rarely, an IgM antibody that's penicillin specific might bind to the penicillin molecule, creating an antigen-antibody complex. Now, it's worth mentioning that antigen-antibody complexes can happen in the course of a normal infection, but it's when an antibody is complex to host tissue that things start to become a problem. The first cytotoxic mechanism of type 2 hypersensitivity is activation of the complement system. The complement system is a family of small proteins that work in an enzymatic cascade to fight off bacterial infections using a variety of mechanisms. In this case, the IgG or IgM antibodies activate complement proteins, which ultimately will kill the red blood cell bound to penicillin, which is complexed now with IgG or IgM. All right, so the process gets started with C1, the first of the complement proteins, which binds to the Fc portion of the antibody. C1 then engages other members of the complement family, C2 through C9, some of which are activated by being cleaved or chopped by an enzyme. The cleaved fragments, C3a, C4a, and C5a, act as chemotactic factors, meaning they attract certain cells, in this case, neutrophils. Once neutrophils join the party, they degranulate or dump a bunch of enzymes like peroxidase, myeloperoxidase, and proteinase 3, which all help generate little oxygen radicals that are highly cytotoxic to cells and can cause tissue damage. When it comes to drug reactions like penicillin, type 2 hypersensitivity can result in hemolytic anemia, sometimes called autoimmune hemolytic anemia, as well as thrombocytopenia or neutropenia, since these are all blood cell types that are often affected. This mechanism is also involved in diseases like Goodpasture syndrome, where antibodies bind to intrinsic antigens on collagen of the basement membrane in their glomeruli in the kidney or their alveoli in their lungs, rather than extrinsic antigens in the penicillin example. The second cytotoxic mechanism requires us to follow the complement system through to the end. That said, C5b, C6 through C8, and a bunch of C9 come together to form the membrane attack complex, or MAC. The MAC attacks the cell by inserting itself into the cell membrane, punching a hole or creating a channel that allows fluid and molecules to flow in and out of the cell. And this is not good for the cell's overall health, right? Because due to the osmotic difference, fluid rushes into the cell, and the cell swells and eventually bursts, called cell lysis, and it dies. And that's the second mechanism, and this is where the name cytotoxic comes from. In our example, if you suspect autoimmune hemolytic anemia, the antibody in question can be detected using a direct Coombs test. In the direct Coombs test, the person's red blood cells are separated from the plasma and then mixed with Coombs reagent, which is anti-human globulin, basically an antibody against human antibodies. If the red blood cells agglutinate or clump up, that means that they probably had antibodies on their surface. Besides a direct test, there's also an indirect Coombs test, which is usually done to check for blood group incompatibility. For an indirect Coombs test, the patient's serum is mixed with laboratory red blood cells that have known antigens on their surface, and then once again mixed with Coombs reagent. If there is red blood cell agglutination, that indicates the presence of antibodies or complement in the serum. The indirect Coombs test is done to determine if you have antibodies before you're exposed to the antigen. For example, this could be like a mismatched blood transfusion or a second pregnancy with a mismatched Rh factor between the mother and the child. All right, so the third cytotoxic mechanism of type 2 hypersensitivity happens when IgG antibodies coat a blood cell that are bound by C3b, another one of those complement protein fragments. At this point, we say that the cell has been opsonized, which means it's targeted for phagocytosis, which is where they get engulfed and destroyed by phagocytes like macrophages and neutrophils. Once opsonized, the antibody-antigen complex in the cell it's attached to encounters a phagocyte in the body's blood filtration organ, the spleen. And the phagocyte targets the cell by binding to the Fc tail of the antibody or the C3b bound to the IgG. Then it engulfs and destroys the cell. All right, so the last three mechanisms involve the complement system in one way or another. The last couple mechanisms are a little different. So the fourth mechanism is called antibody-dependent cell-mediated cytotoxicity, or ADCC. In this case, the bound antigen-antibody complex gets recognized by immune cells called natural killer cells. The natural killer cell recognizes the Fc tail of the antibody and releases toxic granules. These granules contain perforins, which, just like the MAC, form pores in the cell, except that this time the pore also allows entry of enzymes that are like these silent assassins called granzymes, as well as granulysin, which work together to cause cell death in an apoptotic or quiet death sort of way, such that there's no surrounding inflammation. Okay, so far all the mechanisms have led to cell death or cytotoxicity, right? There are, though, non-cytotoxic type 2 hypersensitivities as well, where the antibody just sort of disrupts function, called antibody-mediated cellular dysfunction. Sometimes when an antibody binds to its antigen, it just sort of gets in the way. When this happens, it can change the way the cell is supposed to function.
So this is the one that was said that it would be type 5, but it is no longer type 5. It is still type 2.
This is the case in the autoimmune disease myasthenia gravis, where antibodies specific for the acetylcholine receptor in muscles simply blocks the binding of acetylcholine, which causes the muscles to not get stimulated and progressively weaken over time. This mechanism is also involved in Graves' disease, where antibodies target receptors that stimulate thyroid hormone production. But in this case, they not only get in the way, they actually activate the receptors, causing overproduction of thyroid hormone, or hyperthyroidism. And there you have it, a handful of different ways that antibody binding to cells can cause them to get destroyed or become less effective. The important things to remember about type 2 hypersensitivity is that they're antibody mediated, they generally lead to cytotoxicity, and they're tissue specific. Thanks for watching. You can
Okay, so this was type 2. I'm going to just skim through the various slides because I didn't know whether I would be able to mount this. So yes, ABO blood group mismatch, drugs could, and hemolytic disease of the newborn. We now know that we have ROGAM that we can use for erythroblastosis vitalis. And these are the three ways. First is opsonization that can cause. Secondly is via complement system. And the third one is getting into the way of the receptors. So this was type 2. So we have finished 1 hour. We still have 1 hour to go. Do we continue or do we do it next Wednesday?
Next Wednesday.
You all are tired, eh? Fine.
Yes.
So at least now you have known about 1 and 2, and that should stick in your memory. And I don't want to carry on when you are tired.
Actually, it will give us some time to go through it slowly again.
Fine, that's fine. So what I'll do is